I'm Mark Williams. I'm a fourth generation pharmacist. My family's been in the pharmacy business for over 100 years. Gloria, to talk to you. I'm part owner in Williams Brothers Healthcare Pharmacy with 8 retail locations, 2 long-term care pharmacies. We provide home medical equipment and respiratory services. Also part owner of TrueRx Health Strategists, a PBM started by pharmacists specializing in pharmacy consultant for employers with innovative pharmacy solutions. First of all, I want to commend all the people out there looking for different strategies to help save their employers' prescription costs. I commend everybody for doing that. At TrueRx, we do offer a lot of these solutions in-house. I've been offering them for a few years now. And I know, been working with Troy, with CPESN and his network to implement some of their clinical solutions from the independent pharmacies. So we're out there trying to network with the different people, and all these different solutions that are out there are important. And we definitely offer innovative pharmacy solutions for our employers. I'm an employer with over 600 employees, so I feel the pain of trying to help control healthcare costs. My companies have been a member of Employers Forum for the last 5 years. We appreciate the insight that Gloria and her team has brought to the presentations on healthcare issues. The information has been valuable just as an employer. As Gloria said, Rich Mousty is here, president of Unified Health Services. He is here as kind of a testimonial. He implemented our True Genomics program, and he's going to talk a little bit about that. And that, as Gloria said, Daniel Wilson, he's the Director of Clinical Services at TrueRx Health Strategists. He's here to talk about pharmacogenomics, and I will turn that over to him. Here's Daniel.
Thank you, Mark. Pharmacogenomics is a topic that I'm personally very passionate about as a pharmacist who has sat at the table with patients and providers trying to select the right medications for a patient in front of me. The thought of having that patient's pharmacogenomic profile with us as we make those decisions is an exciting thought, because it would mean choosing the right medications for the best outcomes for that individual, personalizing medications to what's going to work best for the person right in front of us. And that's an exciting thought for any clinician. So what is pharmacogenomics? Big word, but breaking that down, simply pharmaco, the drugs that we take, genomics, the genes in our body. And we're talking specifically about the relationship of those unique variations that we all have from person to person, and the genes that impact the medications we take, how we process them, how we benefit from them, and even how we have side effects from them. We know that there are genetic variations from person to person, right? We can look around, see differences in eye color, hair color. There are differences between people. There are also differences that we can't see in our genetics. And in particular, we're focusing on differences in those genes that impact how we use medications. As an example, I have Mark and Rich with me today, and so let's say that we are all taking the same dose of the same medication, but we have different genomic profiles. If I'm a normal metabolizer, I'm taking that medication, I'm getting the clinical benefit, I'm getting better with no to minimal side effects. Mark might be a rapid metabolizer, and he's taking that medication like he should. He's compliant, but he's processing that medication so fast, there's not enough in his system, so he's not getting benefit. He's basically taking placebo. Rich could be a slow metabolizer, and he's taking that medication like he should, but he's not getting rid of it fast enough, so it keeps building up in his body. Over time, he starts having more side effects and even toxic effects. 3 different people, same medication, same dose, could have different outcomes. Does that sound familiar? We know that pharmacogenomics has health benefits, but we have to pause and ask, is pharmacogenomics worth the financial investment? Several studies suggest that it is, and I want to just highlight a few. One study shows approximately $4,000 per patient annual savings when pharmacogenomics is used to optimize a depression treatment. A lot goes into that, selecting most cost-effective medications, but also the productivity, the repeat doctor's visits that we don't have to do, So we can see a lot of savings there. Another study shows an average of $800 reduction in medical expenses after just 4 months. The study was done by taking people who would qualify, be good candidates for pharmacogenomics based on the medications they were taking. Some people got tested, some people did not. Those that got tested, 4 months later, their average medical expenses were about $800 less on average compared to those that did not get tested. Another study shows reduction in emergency room visits and hospitalizations, 40% reduction in ER visits. So these may not be the most frequent expense, but they are high cost expenses when it comes to the overall medical plan spend. So any reduction there is certainly a positive thing. And of course, you got to ask the question, was putting the person in the ER, in the hospital, that would cause this change based simply on pharmacogenomics? And that's because those medications were able to be tailored and adjusted to what's right for them. Some considerations to think about. If you're thinking about offering pharmacogenomic services for your employees, it's a great idea, and we certainly would hope that you choose TrueRx to provide our True Genomic service. But if you don't, I do want to give you a few things to think about. Number one, what is your desired outcome? There are many different pharmacogenomics programs available out there with varying setup and design. So you have to ask, what outcome do I want from a pharmacogenomics program? Many programs are great about providing the information, providing those lab results. Unfortunately, when it stops there, it doesn't turn into health outcomes. Those results are often 30-page documents of information that patients don't have the knowledge to interpret, and that 15 minutes they have with their doctor probably is enough time to really sort through. If your desired result is a clinical outcome, that patients are able to use that information to get on the right medication, it's important to have a clinician involved to help take those results and turn it to getting people on the right medications. Another consideration is lab quality. Not all labs are the same. So a couple of points to make here. I could probably spend a whole hour talking about this, and I won't. High level though. First point, direct to consumer lab versus a medical grade lab. That is important because the privacy standards around a medical grade lab test is much more stringent, whereas many direct to consumer, I can't say all, but there is possibly quite likely a fine print in there about who that information could be shared with or sold to. Do you really want that out there? The other aspect of quality is the extent of the testing. There are multiple genes that would be relevant with pharmacogenomics, about 20 in all. Now, if you have a panel that's only testing 5 genes, are we really getting the full advantage out of this testing? To dive a little bit deeper into that, are we testing all the variations? Now, we know there's variation in eye color, right? As an example, there's blue, green, brown, hazel. But we know that there's more variation than that. There are different shades of those eye colors because there's a lot of genes and a lot of variations that make up the eye color. So it's important that we looked at the example with Mark and Rich and I, that there's slow metabolizer, rapid metabolizer, normal metabolizer, right? But there are a lot of, just the same as eye color, a lot of different genes that play into how a patient can be categorized. Is the lab testing all the variations that they need to? Are they testing the likely variations that are going to come up in the population? And that does vary some by demographic, ethnicity in particular. And so it's important that the lab is testing what is likely to show up in that population. And if they get a match that isn't what they're testing, what do they do with that? Do they just call it normal and pretend like it wasn't a miss on their part, or do they do further testing? So those are important questions, really detailed, and like I said, we go a lot more into that, but they're important questions to ask. If you're looking at setting up a pharmacogenomics program, make sure you have a clinician involved to help you ask the right questions around this topic. Finally, cost and payment. Do you want to set this up as a wellness benefit or as a covered benefit under the medical plan? The actual expense of processing a pharmacogenomics test is not that much anymore, but it can be very expensive if it's set up in a medical benefit scenario. If it's covered and billed to insurance under the medical benefit, it can often cost much more than a strategy of setting up a wellness benefit. And by much more, I'm talking thousands versus a couple of $100. When you have multiple patients being tested, that can really add up a lot. So we talked about some heavy details there, but I want to bring it home with what does this really mean for patient outcomes, and what does this look like for the patient? So an example that we encountered with the True Genomics program was a mental health scenario. Mental health is very relevant these days, and it's very relevant with pharmacogenomics, as many mental health medications are sensitive to variations in our genomics. The patient that we had a very common diagnosis of anxiety. Drug of choice for that is an antidepressant. And her provider had placed her on an antidepressant, and it was a pretty common one. Unfortunately, it wasn't the right one for her. And as time went on, she didn't improve, and as the provider added an antipsychotic to help boost that effect. Unfortunately, that didn't help either. And what it did do is increase, make her tired, increase blood sugar, weight gain, but it didn't help the anxiety. And the patient would end up being placed on 2 more medications to try to control this anxiety. When we did a pharmacogenomics test, we saw that first drug, that drug of choice, the antidepressant, good in and of itself, but it just wasn't the right choice for that patient because she wasn't processing it right. So we were able to make a recommendation to switch that medication to one that was going to work better for her. Over time, she started feeling better, and we were able to start pulling back those extra medications that were added, streamlining from 4 medications that didn't work to 1 that did. And that is real-life pharmacogenomics. So to highlight on the True Genomics patient experience, like I said, we talked a lot about some nitty-gritty details around genomics, but what is the average patient going to experience with True Genomics? Number 1, we start out with pharmacist consultation. When we identify a patient who is a good candidate for pharmacogenomics testing based on their medications, we reach out to that patient to have a conversation of what is the process going to look like, but more importantly, how can this be helpful for you? The average patient isn't educated on pharmacogenomics, but we can help with that, both with marketing materials and that one-on-one conversation. Having a discussion with a pharmacist about how this test could optimize your medication to make you healthier, that conversation is imperative to the patient understanding the value of the test. When the patient says, yeah, that sounds like a great idea, we send them a test kit, and it is a simple self-administered swab. I have to clarify these days, this is a cheek swab. It is not one of those nasal COVID swabs that we have unfortunately encountered. It is a simple cheek swab that the patient can do and drop in the prepaid envelope and place in their mailbox. That is then sent directly to the lab, and within 2 weeks, that lab has processed the results, and those results become available in a couple of different ways. Number 1, a clinical pharmacist at Truex is going to evaluate those results and see what needs are for changing and optimizing medications are present. We can develop a care plan to discuss with a patient and provider to help streamline medications to what's going to work best for them. Those results also become available on a secure portal that the patient can access, and they can actually view the results along with search medications against their personal genetic profile. So that will enable them in the future to have conversations right there in the doctor's office about, hey, do you think this will really work best for me based on my genes? So it really makes it a much easier tool to use for that patient in the long run. Once we get a patient established on the medications that are right for them, we don't stop there. This test, it is genomics, and so it's not something that's going to change. So we have to make sure that we're getting value of that long term. So we have ongoing medication monitoring. Medications do change inevitably, and so if the patient did the test, we got them on the right medications at that time. 6 months, 2 years later, the prescriber places them on a new medication. Maybe it's a different provider. The patient's forgotten that they did the testing. That's okay. If it's going to be a problem with their genetic profile, we are alerted, and we can reach out to the provider and the patient at that time to say, hey, we saw that you just started a new medication. May not be the best choice for you, but here are some options that would be. So to recap, what does medication management look like without pharmacogenomics? This is kind of what we're used to in medical community, unfortunately, we're used to seeing increased side effects, compliance with no health benefit because patients may be taking medicine that they don't know is really not helping them. We see trial and error and that guesswork of going back to the doctor's office over and over again, trying to find the right medication. So we saw in those studies unnecessary visits to the emergency room and unnecessary costs of medications that employers are paying for medications that may not be helping their employees or may even be harming them in some cases. But what will medication management look like with pharmacogenomics? That's a key difference here. Decreased side effects, increased compliance, prescribers being confident that they're choosing the right medication getting right the first time. With True Genomics, you have a real-time patient portal as a resource. Pharmacogenomics values time. We all wish we had more time. Less time away from work and less squeezing in appointments because we don't have to go to the doctor's office 5 times to get the right antidepressant. And ultimately, reducing medical costs for employers and patients. There was a time not that long ago that pharmacogenomics was this grandiose idea that sounds great in theory, but too expensive, too impractical, just didn't make sense. I argue that that time has passed. Pharmacogenomics is here. It's very practical when done the right way. It is very affordable when done the right way. And the clinical benefits of using it to get people on the right medications that are going to work best for them is undeniable. So we have with us Rich Mousty, who has chosen to provide the True Genomics service for his employees. Rich, would you mind sharing a little bit about why you chose to provide this service?
Sure, Daniel. Thank you for introducing me. Just a couple of quick comments I'd like to make on that, and the thing that attracted me to pharmacogenomics, and we all talk on the health side and the RX side of reducing cost, the ever-growing challenge, and it's usually to the detriment of the employee from a cost perspective. And pharmacogenomics is a different dynamic that we've all never seen before, to be able to reduce cost for the employee and employer, and at the same time enhance the safety to the patient. The employee is very unique, and that was very attractive to me because it's enhancing their benefit, get savings costs, and that's a very hard thing to come by in the benefits world. With 1 in 10 inpatient hospitalizations, prescription drug induced, causing those hospitalizations, this gives us a chance to keep our people healthier and get them the right prescriptions based on the clinical data that's now out there. With 46 new drugs that's came out just this year alone from the FDA, there's no way that any physician, any clinician can keep up with that without having this technology and artificial intelligence. And I love the pharmacogenomics angle because, again, it's all about patient safety and health, and at the same time, again, contain and hopefully reduce costs. So we love the program. We'll continue to support it. And TrueRx is the partner we have for that, to integrate with our other programs, because it's a multifaceted approach to attack the benefit cost problem.